This is Good Day Street Talk.
Well, joining me now is Dr. Ramtin Kassira, who is a board-certified facial plastic surgeon in New York and New Jersey. Welcome, Dr. Kassira. We're going to get to this really cool technology you have here that I got a little sample of just a moment ago. But let's talk first about the kind of skin damage that's done by the sun, the difference between UV rays, right, because we talk about this UV index and then we talk about the heat that's out there. But there's a difference, right? They're not necessarily one and the same thing.
They're not the same thing. In terms of sun damage, Lisa, what you have to realize, it's really twofold. Sun damage occurs early and accumulates over time. So one of the main sun damage sequelae are cosmetic changes such as sunspots and stretching of the blood vessels in your face that cause it to become red, and even progressing to wrinkles and really skin that stretches, doesn't return to its original position. So that kind of cosmetic changes keeps all of us in business. The worst thing that happens is the DNA damage that then can lead and increase your chances of having skin cancer, the worst of which, of course, is melanoma.
Well, let me ask you this, because Christine talked about it a little bit in her piece there. Some people tan, right? My skin tends to turn brown. I'm not fair-skinned necessarily, so I don't burn to a crisp. Is it better if you tan than if you burn?
Actually, that's an excellent question, and people talk about getting a base tan before they go on vacation. But in general, the more fair you are and the more you burn, for example, if you're a redhead and have light eyes and you immediately burn, you have a much higher susceptibility to sun damage and skin cancer than if you're a darker skin type that never burns, closer to the equator. However, your body makes melanin, which is basically a tan, to protect itself from the sun, after which even darker skin patients don't have any protection. So just because you're a darker skin patient doesn't mean you're immune to skin cancer. As a matter of fact, Bob Marley died of a melanoma.
Okay, that is a great point. Well, let's get to the technology here. I mean, one of the things I've noticed, when you're a child, you get a sunburn, it goes away, you look fine. As I'm getting older, I've started to notice that I'm getting different pigmentation on my skin. And just this summer, I went away with my kids. We were in the Bahamas. They got some sunburn, so did I. Unfortunately, when mine went away, I noticed that there was a slightly darker pigment above my lip. Now, let's talk about this, because we got a nice close shot of that darker pigmentation.
So really briefly, this is a method to look beneath the skin where the naked eye can't see, and you look for exactly what we talked about: the sun damage, the pigmentation, the precancers, the dilation of those blood vessels, which we know is rosacea or the rosy cheeks, and what to do about it, most importantly. And I just want to stress that in the New York metropolitan area, there's so many different skin types and ethnicities that it's not the same for everyone, and the treatments and the protocols aren't the same. So we individualize the treatment. So let's
just go through. I think we have a little bit of the tape from before when you took the picture of my face.
Okay.
Here we go. Okay, so you sat me down, we took the picture, went through it, and this was the result that came up. So tell me what we're looking at here on the monitor.
So this is your skin under cross-polarized light, which it just takes some of the reflection away. Now, you have makeup on, so we want to make sure that patients who take this do not have any makeup on. But now I'm going to go look at your rosacea, which, if you see here, some of the makeup is covering it, but you have a lot of dilated or stretched blood vessels here and here and here, and this is mostly from the sun. Okay, now we're going to go to probably the more important one, which is the sun damage here. Right. These pigments here, 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 the large pores, you have a little bit here, are the ones that we want. Yours is pretty uniform. And now if you see a certain spot that's a little bit bigger or more worrisome, we zoom in and we can actually look at spots and map it and then have records of this. So if you come in 3 months and that's changed, we might do something about it. We might take a biopsy, and we also might give you treatments topically to deal with this.
Okay, so how does this look relatively speaking? Is this sort of pretty typical?
This is pretty typical. You're actually better than average, and I would attribute that to you having a little bit of protection because of the darker skin type. But we stress to patients that when they see all the sun damage, they really are frightened, and it's an eye-opener, so they are actually much more compliant with the protocols that we tell them, with the lasers, the skincare. And if I want to show you something here, this is actually tells you exactly in 3 dimensions your skin. You see it shows you wrinkles,
Right.
damage, and you can even
So what is it? Why is it there a darker pigmentation there, and why in this particular part of my face? Is it skin that tends to be slightly more sensitive?
the skin that tends to be slightly more sensitive. For example, you mentioned your upper lip. That's more prone to the sun. Perhaps maybe you didn't put as much sunscreen there, and your body's protection is to send out as many melanocytes and make melanin. And in some areas where it's more, and of course you told me you had kids, so with hormones of pregnancy and after pregnancy, women get what's called melasma, which could be part of why your upper lip is a little darker than the rest of your face.
Now, I think that the general public knows a lot about preventative care, but it's still at the same time, there was a study that just came out this week that 4 out of 10 people surveyed in this particular study still don't use any sunblock when they go out. And I think I, like many other people, only think of sunblock in the summer. Only when I'm going to go to the beach and I think I'm going to be exposed. But you should have your sunblock on all the time.
Absolutely. Obviously, the effects are higher when the UV rays are more intense in the summer. However, a paradox is that people think on cloudy days, putting a little sunscreen, it's okay. Some of the worst sunburns we've seen are on cloudy days when somebody's put on sunscreen. 90% of the UV rays penetrate through the clouds, and also you have to reapply the sunscreen. So I tell patients who are going to the beach every 2 to 3 hours, if you're golfing every 4 to 6 holes, but you have to reapply and you have to do it carefully.
Okay, and you've made an appearance on The Real Housewives of New Jersey. Well, obviously, many of us want to know, can we undo this? And I'm sure that they do as well.
You can undo some of the things. Most, if not all, of the cosmetic effects you can undo with, as I said, topicals, lasers, injectables, and so on and so forth. A lot of the pre-cancers, or God forbid the cancers, the skin cancers, can't be undone. They have to be treated surgically.
Okay.
I do want to mention one thing. As far as melanoma, the incidence of melanoma in the general public in the United States, 1 in 65 Americans during the course of their lifetime will get a melanoma. This year, 20 years ago, it was much lower, 1 in 5,000. So everyone should know the ABCDs of skin cancer. If a mole or a spot is asymmetric, if its borders are irregular, the C is for color. If the colors are too dark, not the same colors, various colors, or if it's bigger than a pencil eraser, please bring that to the attention of your physician.
And just very quickly, because we do have to wrap up, are more people now getting melanomas because of a change in environmental factors, or are more people just seeking a tan?
Probably the combination of both. In today's environment, there is a plethora of tanning salons and tanning beds, unfortunately.
All right, Dr. Kassir, thank you so much for joining us. Have a great weekend. You've made me definitely a little bit more aware. Certainly eye-opening to see that particular picture of me. Well, next up, it may be hot outside, but it could get even hotter in the workplace this summer as employees fight off the blistering heat. How much is too little in the workplace wardrobe? It's professional versus provocative when Good Day Street Talk continues. Stay with us.